Hi, everyone. Welcome to episode 27 of the How to Become a Doctor video podcast. My name is Matt Duras. I'm one of the pre-health advisors here at LSU in Baton Rouge, Louisiana. And I'll also have my colleague, Robbie Bowen, introduce himself.
Yeah, I'm Robbie Bowen. I'm the director of pre-health programs here in the College of Science at LSU.
So, definitely check out our other episodes. But if you haven't, it's okay. This is a standalone episode, as they all are. And we have an exciting topic today that we are calling pre-med Mythbusters. So maybe you heard of the old show Mythbusters, where they took a myth and they figured out if it was true or not. So we have 10 myths for you today. You may have heard it from a friend. You may have seen it on TikTok, something like that. And so we're going to go through and try to bust all these myths. So I'm going to pull up my PowerPoint here, and we're just going to go one by one and share with you guys our thoughts on each of these myths. So here we go. We're going to share this first one right here, which, as we can see, this is you need a unique major to stand out. So, one thing we talk about, Mr. Bowen and I talk about a lot with a lot of students is, you need to pick a major, because pre-med, pre-dental is not a major. So, as we think about this, we realize that, it's a hard decision sometimes. But if you think about it, the dental schools do not require a major. They just require a list of classes. And so you need to do well in their classes they require, and then choose a major that you're passionate about for getting in. And, you also think about, like, science majors are going to prepare you really well for medical dental school. So that's why they can be good. But if you're really interested in another topic, that's great. You just want to make sure you do your science classes as well. Mr. Bowen, I don't know if you had any thoughts you had on that.
What I usually hear is, like, I don't want to major in biology because everybody's a biology major. I want to stand out. So I think if I major in something other than biology, it'll make me stand out or whatever. But, what you choose to major in should be based on what you're passionate about, what you want to learn, things that are interesting to you, because that's typically going to translate into better performance, which is going to lead to a better grade point average and everything. You don't want it to appear that, you're so calculated to try to, like, pick a major that you think, will score you some points or whatever. That's not the right question. You want to pick something that, you enjoy and that will be helpful to you in medical school. But, you don't want to look like somebody checking a box just to kind of have a unique feature or whatever.
Right. Yeah, absolutely. So, a little thing I say to you students sometimes is, your major could be called the best major for medical school, but if you have a bad GPA in the science classes, it doesn't matter. Or your major could be called the worst major for medical school, but if you do well in the sciences, you show your passion, you have a good reason for choosing it, then you can get in. So don't overthink this. If you really are, clueless, maybe choose a science. But if there is something that's non-science, you absolutely can do that. Just make sure you're taking the sciences as well. And either way, I think that's not going to be the reason, what major you choose. So we'll go to the next one here, which is I can make up for a low GPA with a high MCAT or DAT score. So, Robbie, I'll let you take this one.
Yeah. So,
first.
We get lots of variations on this question. Sometimes, my friend got into med school with a, 2.8, or something like that, which, that may be true, but, these two things don't stand alone, but they are very similar in evaluations. And so, you're introducing questions in the mind of the admissions people if they're way out of a line. Like, I have a 3.0 GPA, but I scored at the 99th percentile on the MCAT. Well, then the question becomes, well, are you undisciplined and you didn't go to class, you didn't study? Are you lazy? Are you not motivated? And, vice versa. I killed my GPA. Well, are you just good at memorizing, but are you not able to really apply the material? So, they're two sides of the same coin, and they're both important. And I don't think you make up ground by doing better in one than the other.
Yeah, absolutely. So yeah, it's absolutely true. You don't need to be perfect in each area, but you definitely need to be good in each area because they need to make sure that you're not going to flunk out of med dental school, but also got to make sure you can test take. So
Yeah, and
yeah,
they're looking for evidence that you're going to be able to succeed in medical school. And so, you can present evidence in either of these areas, but if they're inconsistently, if they're just so different from each other, then new questions get introduced in the evaluation.
absolutely. So yeah, so the next one has to do maybe with some of you guys that are worried about getting in. Maybe you had one bad semester, you started off our freshman year, and so you say, hey, I heard you can't have a W on your transcript and get in. And just the quick thing is, it's never about one moment. So sure, if you have 5, 7 W's, you have a pattern of them, or they're very recent, it's going to be different. But if you have AW, or you have ACAD, even AF, and it's one time early, it's a different story than a pattern of this. You have any thoughts?
Yeah, I mean, it's was this just a blip? Something happened, and you were sick that semester, and it's clearly not a pattern of behavior. Like this is clearly not typical of your normal performance. Then that W probably is excused. But again, if it's you know every semester you've had one, or you never finish the semester with more than 12 hours because you're dropping courses or whatever, and just you know in medical and dental schools, there is no W option. You are in a class that they tell you to take, and you pass it or you fail it. And so, that's the concern again from the medical or dental school admissions perspective is you can't drop the course. I mean, if you don't pass that course, you're either asked to leave or you're repeating an entire year of medical or dental school. And so, you got to figure out a way to stay in the class and pass it when you're there. But having one W on your transcript is not going to be the reason you're not in professional school.
So this is a common one we get. Maybe you hear this on a blog or something like, "Hey, I got a C in my biology 1201 a freshman year. Now I've been doing well, but I want to go back and retake this 1201 class because I think that I'll show the schools that I have it down." Well, so what's true here? What's true is that if you have a D or an F, you will need to retake because that won't work for prereqs. But if it's a C, if you pass the class, then you don't need to go back and retake it. You just need to do well in your further coursework. So, if you did bad in the first biology, take an extra biology, upper level, take cell bio and get the A. You're showing that you saw new material and you were successful in that new material opposed to material from freshman year that you've seen before. Plus, we don't even let you guys retake a class that you passed here. Anyway, Rob, you have any
Yeah,
thoughts?
so I think I'll hear, somebody say, well, I want to go back and show them that I could get an A or B. Well, it's material that you've already seen for a whole semester, so you should get an A or B. It's like that's not a big, revelation to them that you did better the second time you did it. So also, it isn't going to really help in your overall GPA. That C is always going to be calculated in your GPA, or even if you take the class again, even if you do the grade exclusion, medical and dental schools count every single grade, regardless of whether it's on your grade point calculation or not.
Yeah, and one thing you'll hear is we'll always say is your most recent coursework matters most. So just make sure your current semesters are going well. So yeah, this is when we talk about research experience is not important for medical school admissions. Robbie, you want to take this one?
Yeah. So I get this a lot, like, do I have to have research, or, I'm trying to find some research so that I can put that on my application or whatever. Research is not something that most medical schools require or expect, although there are some med schools in the country that do expect research experience or require it for admissions there. So it all comes down to where are you applying? What schools do you want to go to? You want to check out websites of schools that are in your top tier of schools, and what is their philosophy? Are they a very research oriented school that has as one of their core pillars or core values is research? Then they're probably going to want you to have some research. But again, it goes back to the same thing that points we were making about the major choice. It's like you don't want to do research just to have a check box that you can submit. Research is something that if you're passionate about it, great. But you shouldn't do it just to have a credential that you can list. Um, why do they value it when you have it? It's showing active learning, it's engagement in the science process. It's not just sitting there and having someone pouring water on into you. You're actually learning the content of the material. So there's like great value in research. It teaches time management, it teaches a lot of skills, but it isn't necessarily a requirement at many medical schools. So you just want to check where you're applying. If they're very research focused, then it would probably help you to have some experience.
Right. Yeah. And I think we're saying this is a myth because it's not a blanket statement. Like, at Yale's med school, we did a presentation with them last year and they said, every student writes a thesis. So, of course, it would be good to have some research experience. But if at your normal state medical school, you're going to practice research-based medicine. So you at least have to have an appreciation of research. You need to understand how it's conducted. You need to be able to know what an abstract is and how to read a medical article. So we're not saying you have to be in a wet lab, working on medical research, but we are saying definitely at least value it, at least consider if you could fit it in. And then if you aren't going to do that, just know, you are maybe going against people that do have some possibly. So just making sure that you're preparing yourself. And so here's one we get all the time. You should take this myth. You should take the MCAT or DAT before you're ready, just to test it out. Robbie, what's your thoughts here?
Yeah, this is a common one. I just want to see what it's like. I'm really going to study over the summer, but I want to go ahead and take it in April or May just to kind of get a feel for it and see what it's like. And that's not a good choice, not a good decision. First of all, it's it's expensive. It's a lot of time and that you're wasting essentially. And so you want to take the MCAT or the DAT when you're ready, when you had time to study. You want to take some practice tests. If you want to see how you're going to do a practice test, that's the same experience, and you can kind of see something before it's on your record. If you take the test, that score is on your record forever. And so there are many other ways to find out what it's like, what's on it, what the content is like by other means than just going in and scheduling a test to do that.
Absolutely. Yeah. Like, as Mr. Bone mentioned, AAMC, who makes the MCAT, provides free full-length practice exams. So you should test it out before you take it, just not with the real thing, with the practice.
Well,
And
the thing is, we there's a timeline out there. You're going to take the MCAT the spring before your application period, typically, or the year before your application period. So this. So start preparing so that you are ready for the test. You shouldn't be like, oh, I'm going to go run a marathon Saturday. I think I'm just going to practice the next couple of days and go see what it's like. You train, you prepare yourself. So the timeline. So really there's no reason to not be ready at the time that you should be taking the MCAT or the DAT.
Yeah, and that really is so important, as Mr. Bowen mentioned, that it's not like the ACT where you can send off your best score, or not like the GRE where you can send off your best score or super score it with the ACT. Because the funny thing is AAMC runs the test and the application. So it's all in the same portal. So you can't send it off. The schools can literally see every score and you cannot hide the scores. You're maximized at attempts. There's a certain amount of time you can take the DAT, you can take the MCAT. And so you're using up a chance. As we mentioned the cost, but the other thing is just how it looks. If you have a great score one time, that looks better than if you have a great score, but it was your fifth time taking it, because they're wondering, okay, it's going to take 5 times for you to pass your step 1, step 2. When you get to med school. So anyway, more of the story. As Mr. Bowen said, take it when you're ready. So here's one about leadership experience. We hear about this all the time. I need leadership experience. And the myth would be you must be the president of a club to show leadership experience. So Robbie, what's your thoughts here?
Yeah, I think that, again, leadership is expressed in many different ways, and some of them are not in any way involving a student organization or a club or an SGA office or anything like that. You show leadership by motivating the people around you, by being a good peer mentor to someone. You show leadership by working in a food, organizing a food drive to donate canned food to the food bank. I mean, there's so many different ways that you can do something on your own without, being part of an organization that shows leadership, that shows organizational skills, that shows that I can motivate others, that I can pull a team of people together. There's many ways that leadership can be demonstrated other than like being in a visible position of authority.
Right, absolutely. Like I love the quote. Leadership is influence of others. So that's the big deal. Is you may be the president of a small club, but if all you do is just meet, you know, 3 times a year to make sure that you have the
Yeah.
club, and then that's it, then it's gonna be
I got a
hard to,
couple,
to do that. So,
I got a couple of my friends together and we went out and picked up trash along the highway, and we do this once a month or whatever, that's leadership. You convinced people to take up their time going and doing a project that was meaningful to your community. So that, anything like that can be seen as a leadership experience.
that's great. Yeah. So, here's one we get all the time. Hey, I'm good because my doctor I work for went to the med school I'm interested in going to, and he's writing me a letter. And when they see his name, I'll be good. So, yeah, the quote is, or the myth is, if I get a good letter of recommendation from a doctor, I am bound to get in. Rob, your thoughts?
Um, yeah, I mean, just because you have a good letter doesn't mean you're going to get in. I mean, you still have to demonstrate all those other qualities that go into an application evaluation. And, again, in terms of letters of recommendation from the perspective of the medical and dental school admissions people, who are you going to go ask to write a letter for you, right? People that you are relatively confident are going to say positive things about you, that are going to present you in the best light. So, it's not that they don't value someone's opinion, especially a physician's opinion, but, he wouldn't be agreeing to write a letter if he didn't know you and all that. And you wouldn't have asked him if you didn't know that they were going to she was going to give you a good letter. So, I would say that it certainly doesn't hurt you, but it's not going to be, something that's going to be a decisive factor.
Right. Yeah, absolutely. Because the thing we talk about is, med school, dental school application is self-report. So, you have to say, hey, I did this, I did that. And so letters of recommendation are often just to, validate what the rest of your application says and say, okay, yeah, there's a real human out there that supports you. But it's really, that's what it's there for. It's to say, all right, like, I affirm this person, but really they're looking at your application first to make sure they like it. So if your letter is to back up and validate you, but you have nothing to validate, you don't have a good, numbers to validate or experiences or personal statement, then, that's not going to hold up anything. And, as Robbie mentioned, the thing is the medical schools, they don't require, most of them, there's some out there, but most don't require a letter from a doctor, because most people can find a good letter from a doctor, but they do require either committee letter or letters of rec from professors, because that's hard to find because it's more objective. And we had one of our medical school deans, she says, anything outside of a committee and professor letter, she calls a love letter, because she just doesn't, as Robbie said, they know that they love you, but you don't know if they're being, if another person would say the same, they can't differentiate. And so the idea is definitely get good professor and committee letter. As Mr. Bowen said, if you get a good physician letter as well, great. But aside from that, like, you've got to be well-rounded.
And it's how well do you know this person? Like, is this just the friend of your parents? Or is this somebody that you've worked in their office and so they have seen you on a day-to-day basis, interacting with patients, and, those are two very different doctor letters also. The idea of like, I'm going to get a doctor who knows people or, who's influential, often is, frowned upon. But, if you're going to get a letter from a doctor, make it somebody that's actually seen you in action, seen you interact with patients, and because they can address that other than, I've known this kid since he was 10 and he seems like a good guy and, all that. they can actually talk about specific skill sets that they've seen you um, demonstrate. And I think that's you know, so just getting a letter from a doctor just to have a doctor's letter is a myth. It's what the letter is going to entail.
Right. Awesome. Yeah, absolutely. And just a short plug for our previous episode on letters of recommendation. Check that out as well. So we're down to our last two here. So, hold on if you're still watching. Number 9, I can get my clinical experience done in my gap year. I hear this all the time. I have a student in my office, and they say, "Oh yeah, well, I'm about to apply to medical school this summer, and no, I don't have any medical experience yet, but all next year I'm going to get all my clinical experience." And I try to remind you guys, whatever your gap year is, whether it's your senior year that you're here at LSU because you are applying, right after junior year, and that's the gap in between when you apply and start, or whether it's the year after you graduate because you thought in your best interest to apply after senior year. Regardless, your application is sent a year in advance, and so you have to have some clinical experience before you apply. They're going to be not sure if they want to give you a spot, a very coveted spot, to be a physician if you haven't actually been out there to see what you're getting yourself into. So sure, you can put future things on your AMCAS or DAT, and sure, these things do have some value, but we really encourage you get it done before. We're sorry that you can't add all these things last minute to them, but some of you guys are in medical dental school 9 months, 10 months before, so you got to get it in early. Any thoughts, Robbie?
Yeah, I think, again, it goes back to perception. Like if you've maybe you just decided that you wanted to be a doctor, you were planning on a career somewhere else, and this the idea of becoming a doctor, I just thought I just embraced 6 months ago. Well, that I can understand then how you may not have a lot of clinical experience because this is a new pursuit. But if you've been pre-med your whole time here and you still are at the point of application without any experience, then I'm wondering why. If you've known that this is what you've wanted to do for this long, it gives the idea that I'm just doing it right now so I can have something to put on my application rather than I'm passionate about getting experience in a healthcare setting, and I've done all these things, and I go to the nursing homes, I do all these other things because it's passion of mine and I'm committed to it. So also the gap year, people think that they can get all this done, but keep in mind the application and everything is a year ahead of time. So they're only going to see what you've done at the time that you're beginning the gap year. Now you can do some updates and you can let them know what's going on. But again, you want everything that you're going to be evaluated on, that they're going to use to make a decision on done by the time you start the application. So that gap year is really not helping you for that current application cycle for the most part.
Right, absolutely. So once again, another plug. We have a whole episode on, if you're like, where do I get my clinical experience? Definitely check that out on one of our earlier episodes. But we made it to myth number 10. If I get an interview, then I can win them over. Thoughts, Robbie?
Um, yeah, there's a lot of ways to go with this statement and this myth. First of all, getting an interview is not easy. It is very competitive when you think about thousands of applicants and hundreds maybe of interviews. First of all, you got to have credentials to be worthy for them to even invite you for an interview. So it wouldn't be just, putting my eggs in that basket. I mean, you still need some credentials to get you there. And also, it's depending on how this statement's being made. Like, if it could come off to be like an arrogant, entitlement, attitude that you have when you walk into a room. I'm going to blow these people away with my brilliance and my whatever. That's not going to go over well as well. If you mean I'm going to work really hard and be very prepared and I'm going to, make sure that I have fully thought out and, I've spent time internalizing what message I want to get across and all that. Yeah, interviews can make a big difference, but, there's a lot of steps that you have to, get through to get to the interview.
Yeah, no, I think that was well said. And, just back to the basics here, like you don't need to be perfect in every area, but you need to be good in every area. So it kind of goes like there's no secret sauce to getting into medical dental school. It's, being well rounded, and you need to be able to interview well. But, if you have a really low score in something or something that's not there, even if your interview goes great, they're going to have a lot of people that interview really great.
Yeah. And I
And
think
the classes are small.
there's a thin line between, confidence and arrogance and, a sense of entitlement and, those kinds of things, which are, not, don't go over well with admissions people. So yes, I want to be confident, but the confidence that I'm having is because I've prepared. I've been spending time, getting ready for this moment in my life. I've, internalized all these things that I've learned on all my experiences, and I have a story that I'm going to be able to tell them. Then yes, that interview can be extremely effective in helping you, you know, stand out in the other people that they've interviewed.
Yeah, and you can't control who's going to interview you. So maybe someone that really connects with you, it may not be, but you don't want it to be bent on that so much, put so much weight on that one thing. So, I mean, that's our myths right there. But I did want just to leave a chance, um, you know, Robbie, if you want to mention any other things that came to mind with
Well,
this topic.
I think, what does it all come down to? Like, all these things that we talk about, and everybody's situation is unique. Everybody's application is different. Everybody's life experience is very different. What it all comes down to is they're looking for people that have a record of consistent, um, high standards of performance in the classroom, in the community, in their campus, whatever it is. And there's no, as we've said, there's no formula that you need to have. But you should be doing these things because it's a passion, a drive, in within you to want to be a compassionate healthcare professional, not to, rig the system so that I get an advantage over somebody else. And so whatever you choose to do, there's no right or wrong choices or decisions. It's what you get out of it. It's what you contribute, how you contributed to that. And so, the number one question that I, don't like as a pre-med advisor is, will this look good on my application, or should I do this to help my application? Because that whole motivation behind that question is, you're missing the point. And so, if you say, I have an opportunity to do this, do you think this is a valuable experience? That's different, but will this look good on an application is the wrong motivation.
Right. That's exactly. It's going to ooze out, if you're just doing it just to look good. But I just want to mention too, I think, Robbie barely, he barely went into this. There's a whole other conversation, but the idea that you all are unique. And so you're going to hear of a friend that got in with these unique circumstances. But I think the reason we're busting these myths is because, like, don't try to be that unique person that got in with that low GPA. Try to be good in every area and go off the averages. So don't say one time you heard one person did this. It's on average, this is the average MCAT score at the school I want to go to. Let me try to get as close as I can.
Yeah, and every data point that you look at, this was the lowest GPA that they took. This was the lowest. Every one of those data points has a story that goes with it. And so, that one data point is not what got that person in, or what, there's a whole story of, that goes along with each one of those. And so focus on building your story, getting your, credentials in order, rather than, trying to predict what you need on a test score or a GPA.
Absolutely. So once again, if you have more myths you need busted, you're not sure, definitely come in for pre-med advising. But thanks for joining us. Definitely share the podcast, like, subscribe, all the sorts. If you have ideas, you can definitely email us at science@lsu.edu to send any podcast ideas. So thanks again for joining us.
Thanks.